So I want to introduce myself. I am Brynn Bell. I'm the social worker at George Washington Academy. I'm a behavior analyst and a licensed mental health therapist. So I'll be talking a lot about the skill building and behavioral piece tonight. And this is my husband, JR Bell.
Hi, guys.
And he is, I'm going to put you over here for a minute. He is the manager at Hurricane Family Pharmacy and is a pharmacist that will be talking tonight about the medical options.
Yeah.
Is that right?
Medical
intervention kind of stuff. We are also parents of students at GWA, and we have been since 2012 when our oldest started there. So we've had lots of students go through GWA. We've had a lot of history with being at GWA, and so we're still in your shoes. We've been in your shoes as parents. We are also parents of a child with moderate to severe ADHD. And I put depending on the day, because sometimes it's moderate, sometimes it's pretty severe. But so we're coming at this in lots of different angles. We're coming at this professionally, but also as parents who have had our own struggles and successes and learning curve with these kind of symptoms. All right, so that's who we are. Let's move on. Awesome, thanks. So the first thing I want to talk about is evaluation. Evaluating your child is really important. This is not just parent evaluation, but child evaluation, meaning that it's important to know these things about your child. It's important to notice struggles your child is having, barriers for your child, or strengths your child has, to really evaluate how your child is doing and looking at these things. It's not often or maybe natural that we assess our kids in these areas because we're not in the classroom with them, or we're not necessarily requiring a lot of focus and attention at home. It's a much more free environment with a lot of different stimulation. So it's important that you do take the first step to evaluate your children in these different areas and just kind of check in and see how they're doing, how you feel like they're doing, to just keep on top of whether this is a concern or not. Whether it is or not, hang in there, because I think some of these skill building things are helpful for every kid with a developing brain, right? Executive functioning is going to be something we need to work on for all of our kids. But knowing this about your children is really important. But the other thing is a child evaluation as well, checking in with your child, checking in and asking them, how is it going? How do you feel like you are doing with focus? Is it hard? How do you feel like, how successful do you feel in school? Are these things tricky for you? Are these things hard? What's going on with this? So checking in and letting your child even voice how they're doing. The kids are really quite aware when I talk to them about things that are hard for them, or barriers they want to work on, or goals they want to set. And so knowing that can help us as well. Now, not every child with these, with barriers in these areas or difficulty in these areas has ADHD. Some of this can be very normative with developmental. So it's just kind of evaluating like how many of these are an issue and how severe, how concerning, or how impactful in different areas of life. So motor hyperactivity, looking at like their body and how hyperactive and how difficult it is for them to sit in a chair, how difficult it is for them to sit at a meal, how difficult it is for them to hold still and focus on something that requires stillness. If they have fast or constant speech, if their speech is tangential and going in lots of different directions, if they're nearly constantly talking to you or over you, that might be a concern. Difficulty focusing, impulsive behavior, acting without thinking, short attention span. So a developmentally appropriate attention span would be 2 to 3 minutes per year of age. So if you want to look at this with your kid, if you want to do a little bit of assessing on your kid, do some of this math and then sit down and see if they can work on something you hand them for that long, right? Can they read a passage in a book? Can they work on a drawing? Can they color a picture for that long? Can they work on a puzzle that long? So you're looking at attention span and doing some of that math and timing it. Like, can my kid sit down and have focus on one thing for that developmentally appropriate attention span, independent of me doing it with them, which is more of a social activity, but more like just independent work. Can they sit and focus on something that's age appropriate? Does your child have high stimulation needs, constantly needing something in front of them, something to be doing, something really high stimulation like a screen or video game, or constant entertainment? Do they have difficulty making or keeping friends? Has that been a concern? Are they constantly or a lot of the time noise making or fidgeting? Are they aggressive in any way or space invading? Do they lack boundaries with other people? Do you notice them daydreaming or checking out? Where they kind of zone out, miss what you said, miss the instructions? Do they overfocus on the wrong thing at the wrong time? Sometimes a focus issue is not just a lack of being able to focus, but actually focusing on things in the environment that are novel or in the background. So instead of focusing on the teacher, they're focusing on the clicking of the clock or on a kid coughing next to them. So if your child is struggling to focus on things that are background, if several of these are present, then it's probably imperative that you begin targeting them for decrease. We start working on some of these things with that child to gain some skills, because these are going to be a significant barrier if there's several of them getting in the way of focus. If several of these are present across differing environments, then it might be helpful to have a professional evaluate. That might be appropriate to see if maybe there is more going on here than just developmental difficulties with these areas. Okay. Okay, so I have parents often say to me, like, well, we don't want to evaluate our kid on this or work to see if any of these are an issue for our kid, or we don't want to kind of look into this because we don't want to medicate. That's like a big thing people say to me all the time, like, well, we don't want to medicate. And I say, that's totally fine. That is up to you. That is your prerogative. But there's a lot of ways to address these barriers. And medication is just one of those ways. So what I usually ask is, okay, that's fine, but what are you doing to address these barriers, or what are you doing to treat this, right? Medication is only one way to treat it. So what are we doing to treat these difficulties or symptoms? And then do you plan to exhaust all of these options? Because if you don't want to medicate, that's totally fine. But there's a lot of other things we can be doing. So ignoring these symptoms or difficulties is not beneficial to a child. We need to look at them and address them. Here's some options to do that. So there's targeted skill building. We're going to go over that today. Lots of practice in skill building, repetition, and really building pathways in that brain. Environmental structure is going to be huge and important. Diet, sleep, and exercise are going to be really important. We'll go over some of those. Executive functioning help. Neurofeedback is one of the treatments out there, and I can briefly touch on that. And then JR is going to talk about over-the-counter medication and prescription medications. Okay, so I will start with skill building, and I'm going to go through this fast, but we will post the slides so you can go through them and read them on your own time as well. But it's important for all of our kids that we don't rescue, right? We allow them to learn from mistakes. We allow natural consequences to happen. We allow discomfort. So don't teach them to fear discomfort, but rather to get familiar with it and to recognize it's going to be a part of learning and growth. And frustration and challenge are not something to shy away from or to quit just because you're feeling those, right? There's something to get used to, something to get comfortable with. And so helping your kids to encounter those, helping your kids to encounter times when they are being pushed a little bit to the point of feeling frustrated or challenged instead of avoiding that can help them to gain the skill of perseverance and growth mindset. Directly teaching and labeling, and then practicing skills. Now, this is really important when parents come and say, well, yeah, my kid struggles in these areas. I don't want to do any medication. No problem. Or even if your child has a diagnosis or even is on medication for these things, I still think it's really highly important that these skills are targeted directly. They're not skills that are going to be targeted directly in a school setting. I want to be clear on that. We are providing an education at school. And during that education and social setting, we have a lot of opportunities to practice these skills. Executive functioning skills are practiced a lot at school, and that's wonderful. But we don't necessarily sit down and target an executive functioning skill and work on it and practice it over and over and over. That kind of targeted growth in a skill is going to have to happen outside of school or at home. You want to be intentional about recognizing from the earlier list what struggles might be present for your child and working on those. So working on very specific skills in specific structured sessions or activities. We'll talk about some examples of those, but one at the bottom of the slide is like saying to your child, waiting can be hard. We're going to work on waiting. So I'm going to set a timer and I'm going to have you sit and practice waiting, for 1 or 2 minutes. Okay. And while that timer goes off, it's going to be boring and kind of hard, but I'm going to have you practice just waiting and being bored, but being able to just tolerate that. So when the timer goes off, if you've been able to wait calmly, then you get whatever. So that's just one example, but that's an example of a targeted executive functioning where you are taking a skill that is hard for your child and you are working on it very directly and clearly with your child. And then you can even increase that challenge and growth and see if you can build that skill and brain pathway to tolerate some of these hard things for kids. That's the type of teaching I mean is not going to be happening at school as much as more education is going to be happening. So we're not targeting skills like this and working on them, especially in some of the older grades where those skills are kind of just expected to be there at a developmental level. Creating independent work sessions. So like having your child do some independent work or some independent skills or tasks, like I'm going to give you these instructions and then I'm not going to help you with this. I want you to do it. And I want you to do it for however long is that attention span that's developmentally appropriate. So we'll set a timer and I want you working on this independently and see if they can stay on task and practicing that. And if you've noticed that they can only do like 4 minutes, then we work on building that up. Okay. Break down any tasks that are large into steps. Help them memorize checklists or steps. Help them memorize the steps to a routine that is something that's regular. So if they have a daily routine, help them memorize maybe their morning routine with a visual or a checklist, but then helping them memorize those steps and become more independent as time goes on. Taking pictures of completed outcomes can help so that you can compare, like, does your sink, when I told you to do the dishes, look like the picture, this empty sink, or does your bedroom look like the picture? I need you to keep working until it looks like the picture. That can help kids understand the end result or help them kind of self-manage and be like evaluating their own work and keeping themselves going until the end of the task. Try to use visuals or checklists to fade out prompting from a person. So if you're prompting your child for routines or for homework or anything like that over and over visually or verbally, try to use visuals or checklists to fade out your own prompting and then redirect them to their checklist. So instead of me telling you what to do, I'm going to have it on your checklist and I'm going to say, well, look at your checklist, or what's next? You check your list and find out, so that we're building that independence so that we can fade out as their constant prompter and fade in tools that they can use to build their own self-management of their attention span and focus. Here are some ideas to help. I'm going to race through these. So go ahead and read them later if you need. Keeping a routine is really important. Challenging perception errors. Using your carpool time wisely. We all know at GWA there's carpool time. That can be used wisely if you're thinking about how to keep your kid focused. Transition times can be difficult. So maybe we stay in the car at the end of school and park somewhere and do a little bit of homework before we head home or before we walk in. Maybe we do some organizing of the backpack in the garage, that kind of thing. Games can be a really, really helpful way to build executive functioning skills. So board games, card games, or chess are extremely helpful for planning, weighting, working memory, focus and attention, perseverance, impulse control, right? You have to wait your turn. You have to not touch my pieces or my cards. You have to handle disappointment. So there's a lot of really great skills that can be targeted in just playing games with your child, but not video games. We're going to get to why that is. Video games are not going to be part of this category. Praise effort and focus on their work instead of on their performance or the product. Intersperse easy tasks with hard tasks, right? Just kind of going back and forth between those. So rotating between work and a break, or rotating already acquired skills, something that you know how to do, it's pretty easy, to something we're working on that's harder, that we're still learning. Or rotating preferred skills with non-preferred. Maybe you like math a lot and you feel confident and good at it. So let's do a math problem and then let's read a paragraph and then let's go back and do a math problem. So something like that where you're rotating preferred and non-preferred. Use breaks to help the child break up work sessions or focus sessions. So focusing for this amount of time, maybe I use a timer and then we're going to have a break. It's a short break. And here's some examples of just a quick break we can have that's fun and engaging. And then let's get back and do maybe another 10 minutes of work session. But take the time to teach the why to your kids. Don't assume your kids understand why executive functioning is important. Don't assume that they understand why organization is important. Most of the time, some of the time, they just think we're being difficult or we're pushing something onto them that's silly, or that we like a clean room, but they don't. So they're like, what's the point? Why do you make me clean my room or whatever? And so these are some helpful books. And there's a lot out there. These are just a few examples to really help them understand the why and the reason that we're trying to work towards these skills and how helpful they can be in the long run. This slide is about recognizing if your child is understimulated or overstimulated. Those are going to look different, and they're also going to have different tools that you use. Both of those can occur in every child, right? There's times when every kid can be understimulated, bored, restless, or overstimulated, where it's just too much for them and what you're demanding is too much, or what's going on in the environment is too chaotic. And there's some suggestions here that you can read through. I'm going to leave these up for you to just read through on your own so we can move on. Go ahead, Anjanae. I'm going to leave them in the slideshow. Some environmental structure. Environmental structure is extremely important. If you plan to work on these things with your child and really target these skills for development and target these struggles for management, then environmental structure is going to be huge. These are just some examples of checklists to keep your child on task, checklists to really show them what their responsibilities are, what their schedule should be, what they should be doing, and in what order. These are different developmental levels, so you can do this at different ages. Make sure it's age appropriate for your child. So if they're younger, keep it simple, like the one on the right. If they're older, they can manage maybe one that's more complex, like the one on the left. Just more examples of checklists, visuals, prompts that you can put in the environment that help your child be more independent and less dependent on your verbal prompting. In a classroom setting where there's 28 students, this teacher is not able to prompt your child verbally for every step of a task or every step of the way. So getting your child used to doing some of this on their own and not being so dependent on a verbal prompt is really important. These are some helpful apps. If your kid is older and has a phone, I really recommend downloading some apps that can help with focus or calendar or organization. Those can be really great for teens to start managing their own schoolwork, their own money, their own time and calendar. I also recommend some of them for on your own phone for younger kids if you want to use some of them to help your child build some of these skills. So these are just some ideas to check out. They have different kind of functions, but apps, just letting you know that apps can be really helpful, and there's a lot of great ones out there. There are also really other great tools that help with focus and attention and building those skills. Vibration watches are available on lots of different websites. You can find them on Amazon. You can find them on very specific like ADHD websites, but they're usually a little more costly. And really, they're just a simple timer watch where you set how often it's going to vibrate. And your child wears the watch, and it's just a vibration that happens every so often to remind your child to stay focused or stay on point. It's a check-in, basically. I teach kids to self-check-in when that vibration goes off. What's your body doing? Look down, look around. What's your body doing? Are you focused? Are you on task? What are you doing right now? And if they have a vibration watch and even an earning program that they're charting, that can be super helpful. So if they have a vibration watch that goes off, let's say every 10 minutes, and at that 10 minutes, they do a body check and they mark themselves as a smiley face or a frowny face on their chart, and they're doing that all day, they are self-managing their own earning system, their own program to earn their reward or whatever they're working towards, and they're doing body checks and self-managing their own focus. It's a great tool as well to just kind of keep them noticing their own attention, noticing if they're on task. It can be, vibrating every 10 minutes, every 20, depending on your child's needs, but that's something that's helpful. Clocks are super helpful. Having clocks in different areas of your home so your child can manage their own time and routine and can start getting familiar with how long things take and how to stay on task and on time. That's really important, that you're not your child's clock. You're not telling them the time constantly, but instead that there are clocks around and they're learning to read those and use those. Day planners are extremely helpful. Calendars, Post-it notes, these can all be really beneficial to help your child manage their own organization and focus and keep them on top of things. Timers, like I've mentioned, are awesome. I love using timers for kids with focus issues. Noise reducing headphones. This is not headphones that are playing music. These are just headphones that reduce the noise in the environment so that they can maybe focus on homework or focus on what they need to for a little bit if they need to reduce siblings' noise or something else going on. A weighted blanket can be really helpful for kids with any type of hyperactivity or kind of impulse control. It can really be beneficial at night if they're struggling with settling down for sleep. Scheduling a regular organization check-in is super important. If you are, if you have a child that struggles in these areas, scheduling a regular time to go through that backpack to really help them get organized, to really make sure they're keeping up on things and checking in with them is super helpful and supportive. Support is really, really important for these kids. And these are things that are not going to be provided by your child's teacher. It's unlikely that the teacher is going to be able to go through their backpack regularly with them and teach these organizational skills. A command center in your home where everything is kind of like located centrally, specific papers or dates or flyers or things we need to keep, library books, etc. A study or work area where that's where we do homework. That's where we work and focus. A charging station where we charge, whatever computers we need the next day, whatever phones we need the next day. Those are all really helpful areas to set up in your home for structure for these kids' success. Learning software can be really beneficial. You may say, well, my kid focuses really well on video games. We'll talk a little bit about that later. If that's the case, your kid may do well with learning software like math games or reading games a little bit better than a low stimulation way of learning that material. So that's something to explore if they need some work in academic areas. The Pomodoro technique, there's books you can order on this. It's a fantastic technique for kids and adults alike to prevent procrastinating. So that's something to look into. It's really excellent technique to use.
Brynn, there's a question from Liz. She asks, how often do you schedule the check-ins?
Great question. That would really depend on your child's age and skill level. If you're talking about like your teenager is semi-responsible and somewhat building and developing in these skills, but still needs some support, you may do it once a week. Let's go through your backpack on Sunday night. Let's get it ready for the week. Let's make sure you've got, everything planned out for your soccer bag, and let's get you ready and let's make sure your calendar has all of your stuff for the week, kind of thing. But if your child is younger or really struggling in these areas, it may be nightly. It may be every single evening we're going through the backpack. We're walking through all of this. We're keeping up on things and making sure that we're checking in with your organization. It's a great question. I'm going to hit this really quick because I think everyone's pretty familiar with the diet recommendations for kids with any focus or attention deficits. A high protein diet is the most researched and recommended for kids with attention deficit, hyperactivity, or focus struggles. Impulse control is really focusing on a high protein diet and making sure that protein is available in most every meal that they're having throughout the day, especially during their school day or learning times. That also can help you because a high protein diet typically will reduce their intake of simple carbs and processed foods. So avoiding simple carbs, white flours, and processed foods is really important according to the research. A diet lower in sugar as best as you can, a diet that avoids food dyes, especially red 40, which has been directly linked to struggles with ADHD or ADHD-like symptoms. Avoid foods high in natural sugar like juice or too much fruit. That as well can also just act as sugar in the body and cause some hyperactivity or blood sugar drops. A sleep routine that remains the same as best as you can, including across the weekends. And that's tricky, I know, but if your child struggles with sleep or struggles with focus, it's important to maintain a routine as best as you can across as much as you can. But sleep, especially the same bedtime, same waking time across the 7 days, is ideal. And then checking in with your child on their sleep quality. Finding out, is your child night waking a lot? Are they looking at the clock a lot throughout the night? Are they getting up and getting a drink multiple times and you didn't realize that? Talk to your child about their sleep, but also their sleep, like their struggle to fall asleep, how that's going, or their sleep quality throughout the night. Sometimes that can be surprising. And we find out quite a bit that child's having more sleep issues than we realized. Really fast about ADHD. We're talking today about ADHD-like symptoms or ADHD-like barriers. Now, it doesn't mean that your child has ADHD, and we don't want to assume that kids with these struggles have ADHD. They may or may not, but I do want you to understand that ADHD is a very real disorder. It's a dopamine deficient brain. So that brain is not motivated by ordinary, mild, intrinsic, or long-term rewards like maybe other kids are. That brain is typically just needing a lot higher dopamine to be motivated, a lot higher reward feedback to the brain. So what that means is it needs higher stimulation, stronger incentives, more immediate rewards, an element of challenge, an element of competition, something novel or new, exciting, something risky or extreme, something immediately pleasurable. So these are kind of the key to really tapping into motivation. If you have a low motivation child that struggles with focus or attention, or an ADHD child that struggles with motivation, these are probably why, is that they're going to require higher levels of dopamine to get to tap into wanting to do something. And so these are some things to really consider. What are we doing to make the learning higher stimulation, to make it exciting, to make it an element of challenge. This is why when people say to me, my kid can totally focus on a video game, so there's no way probably it's ADHD, or I don't think they have a focus issue at home because we've never seen it, because they focus on their video game just fine. But if you consider what a video game offers, it offers all of these things. Really, we all need to start looking at video games and trying to generalize those things into learning and into tasks that we're asking of these kids, because there are elements of challenge. There are elements of competition. It's exciting. It's immediate. There's stimulation. There's all these things that are really working for that child to focus. So for us to be as successful in getting that focus as a video game, we need to start looking at some of these elements and working those in. ADHD does not mean a kid is self-serving, lazy, irresponsible, or incapable, just that they need higher levels of these things to be motivated or interested or focus on something. I want to talk quickly about some of the concerns about not treating ADHD or even ADHD-like symptoms. It is among one of the most debilitating disorders to live with if untreated. Risks in childhood include academic, social, and emotional problems. Adolescents that go untreated are at much higher risk to use drugs and alcohol to self-medicate. The research on this is astounding at how much higher they are at risk for substance abuse. They are much higher risk at engaging in risk-taking behavior, having automobile accidents, and engaging in sexual activity. In adulthood, untreated ADHD can result in lower job performance, marital and family relationship issues, mental health problems, and decreased automobile safety. So we really just can't ignore these symptoms in kids, in our students, in our kids. If these are these are barriers that you notice in your child, but they're not super significant, your teacher's not mentioning anything, or you have tried these assessment, sessions to see how your child does, and it's really not massive or major, it could be just simply developmentally, these are skills that are still coming for your child. But if these are pretty big barriers, then we really can't ignore them. There's some astounding research that I've shared here that is really concerning about ignoring ADHD or ADHD-like symptoms and not targeting this with treatment of some kind. You guys can read that on your own, but the research is really alarming. I think it's really just important that we take these things seriously and assess our kids and are looking at what are we doing to target these things or treat. Now, evaluation does not always mean diagnosis. I mentioned that. It might just mean that we recognize some areas our child needs skill building and that we need to focus in on working on. Evaluation does not always mean diagnosis, and diagnosis does not always mean medication. So you may get a professional evaluation, you may even get a diagnosis, but that doesn't necessarily mean that treatment equals medication. There's, like we talked about tonight, a lot of ways to treat this, a lot of ways to address it. We need to not be afraid to assess or evaluate our children and look at these things and not ignore them, and make sure that we're helping support our kids in all these areas. Sometimes diagnosis can even remove blame from the child and help everyone work together in a collaborative way and intervene and help that child to understand how their brain learns and help everyone around them to teach in a different way. So sometimes it can really help us understand that brain a lot better. We know a lot about ADHD. We know a lot about ADHD-like barriers and can really adjust the environment and the learning to be better for those kids and that brain and how it learns. Okay, I'm going to turn it over to JR for medication.
Oh, Liz, my turn. Oh, okay. All righty, guys. Nice to be here with you tonight. I'll just go over some of the medication options. Again, my name is JR. I'm a pharmacist at Hurricane Family Pharmacy. Let's start with some over-the-counter options. I'm a big fan of multivitamins, a good high-quality multivitamin. I recommend, there's one called Smarty Pants. You can find it at Costco for a pretty good price. It's got some omega-3s in it. we know that multivitamins are good for the immune system, but they also might help ourselves and kids that don't get the diet that they need to be getting. So,
and they're gummy.
And they're gummies, yeah, and they're delicious. So the kids like
gummies.
Them. Caffeine kind of has an opposite effect for kids with ADHD. Sometimes it can kind of calm them down, but it still can kind of affect some sleep. So you don't want to do that too close to bedtime. Amino acids have been found to help kids with mild ADHD. There's something called 5-HTP, which is an amino acid. And there's different forms of that in liquids or tablets. Omega-3 is really good for brain development, cognition, and that might help with mild ADHD, as well as magnesium supplements. And there's a variety of those. MagCalm, there's powders you can put in drinks and different magnesium options that might kind of have a calming effect for some of these kids. As far as and these are a good start. Again, they're going to help with mild cases. For moderate to more severe, there's two types of medications for ADHD. There's non-stimulant medications and stimulant medications. So those are kind of the two classes. Non-stimulant medications, you may have heard of some of these. Strattera is one, and then clonidine and guanfacine are another in the non-stimulant family. These are great for kids that might have a hard time sleeping, because one of the side effects can be a little bit of drowsiness. So that's pretty common in kids with ADHD. Also,
so you take them at night.
Yeah, so most of these non-stimulants typically are taken at nighttime, especially the clonidine, because that one is pretty sedating. And they also can help with anxiety. A lot of kids with ADHD have some anxiety as well, so it's good for that combination. Some of the side effects with those, sometimes a little bit of, like we said, drowsiness, GI, sometimes some stomach issues, dry mouth, and they also can lower blood pressure, which can lead to some dizziness. So they want to make sure they're regularly being checked on their blood pressure with the pediatrician, and you don't want to stop.
Those have to be regularly taken.
Yeah, and those are taken every day, sometimes twice a day, usually once a day, and the gold standard for ADHD as far as medications go are going to be your stimulants. These have been around since the 50s, so we're talking 70 years of data and research. Ritalin came out in the 50s. Adderall, I'm sure you've all heard of. Concerta, Vyvanse. There's a variety of different brands. Most of them are generic now, which is more cost effective. So typically kids under 6, we're going to start with behavior therapy. Sometimes we'll have kids start medication in the 3 to 5 year old range if it's severe, but a lot of times we'll wait till they're about 6 years old. And the combination with behavior therapy and medication seems to be best for most kids with moderate to severe ADHD. As far as the stimulants go, there's short acting and long acting, and there's pros and cons of both. The short acting you're typically going to give twice a day, so in the morning before school, and then usually after school or at lunchtime. The long acting typically, once a day. Sometimes the long acting can be a little more expensive depending on your insurance, but there's trade-offs with both of them as far as prices go and whatnot. But really, it's about finding the right dose and the right med for your child. You may start them on a long-acting methylphenidate like Concerta, and it may or may not work. And you could switch. Your doctor might switch to Adderall, and that may work, and vice versa. So every kid's a little different. Just because one does or doesn't work doesn't mean another one won't. So there's a little bit of trial and error, finding the right dose. They do work right away. Unlike some medications that can take weeks or months, usually you'll see a result pretty immediately with those. Side effects with the stimulants, the biggest one's going to be appetite. suppression. So you may see some weight loss with your kids. Important to just kind of time meals right. Give them a good high calorie fatty meal before you give them the medication is a good idea. Sometimes a little bit of abdominal pain, headache, and sleep disturbances are possible. Some people will raise the concern of growth. Will it affect my kid's growth? And that's pretty rare. Usually we see this on kids on higher doses, and it's less than a half an inch, again, in rare cases. So usually nothing to be too concerned about, but you can, have your pediatrician do regular checkups and screenings for that. And then, so that's kind of anything else on stimulants you want me to, that's kind of the basics. And then moving on to sleep. A lot of kids with ADHD do have difficulties falling asleep, staying asleep. CBD oil is real popular for adults. I take it for sleep at bedtime. Not a lot of studies in kids, so I'd just kind of be aware of that. Check with your doctor on that. Melatonin as well. It kind of helps tell the brain, it's time to go to sleep. So just kind of something natural that your body makes. I wouldn't recommend more than 1 or 2 milligrams of that for kids. And those come in, you can find them in gummies and dissolvable tablets, which are nice for kids. An amino acid supplement, like we talked about, magnesium, and then the other 2 medications are good for kids that have a hard time sleeping. So with anything, with medications, you want to outweigh the benefit and the risk, right? Is this going to help my kid in school? Is it going to help him with friends and socially? What are do the benefits outweigh the risk of, maybe a few pounds weight loss, or they get an occasional headache? Maybe not. That's a decision you have to make with your child and with your pediatrician. But they are effective, and they do, for ADHD, they do a good job. So,
thank you.
Yeah, you're welcome.
Okay. Yes. I don't know. Can you mute that? Okay, we're going to open it up to any question and answers. Feel free to log off if you need to. We can be here as long as you need to answer questions, but no, we're not offended at all if you log off and are all done. This videotaping and this slideshow will be available at the GWA website under Resources Counseling Center. And then you'll see parent nights.
And I'll also be emailing it out to every family. So.
Oh my gosh, you're amazing. Thank you.
Mm-hmm.
So I'm going to switch to gallery view. Go ahead and unmute if you have a question, and we're open to staying and answering any of those.
I would love to just set up like a meeting with you to talk kind of about my kid individually. Do we just kind of do that through the office?
That is perfect. And I love to do that. I love working with parents on their specific family structure, home, and child. And we can do a lot of problem solving that way. You can just email me directly. My name is Brynn Bell. So it's bbell@gwacademy.org. And yeah, you can also call the front office and they can email me or have me call you back kind of thing. But yep, you can call, you can email.
Perfect. Thank you.
Yeah. And my email's in the chat if you didn't quite catch that.
I have a quick question. In my previous, we lived in California before, and they had different sessions where they'd have kids work on specific skills at school. So my son was about, I think in kindergarten, to work with other kids, maybe a group of 4 or 5. Did they do anything like that at GW? We're new to the school, but Just curious.
Yes, welcome to GWA. Yay.
Yes,
Yes, I should have touched on that because I did say like these aren't directly targeted at school, but what I meant is these are not going to be directly targeted in your child's classroom by your teacher. So don't assume that your kids can gain those skills at school, but you are, yes, correct. We run small groups. I run some, and then our other counselor, Christine Staples, runs some. We run small groups that target very specific skills. Yeah. And so if you want your child involved in any of that kind of skill building at school, or you're interested in discussing any of the groups we run, reach out to me for sure. I'd love to talk with you about it. We run groups on anxiety, emotion regulation, growth mindset for kids who struggle with perseverance. I run groups on family change. So for kids who've been through divorce or family changes. And then we run groups on impulse control and learning to focus and organize and things like that. So yeah, lots of skills are run in those small groups.
Thank you so much.
Are those groups run during school or after school?
Yeah, great question. They are during school. They are 30 minutes a week, and they're at the same time every week. So if like your kid's group is Tuesdays at 9, then they get called down to the office Tuesdays at 9. They kind of get used to knowing that's when their group is. They meet at the office and I take them and do group. Those are arranged with the grade level teachers so that it's a pretty good time to be taking them out. They're not missing. We're careful to make sure they never miss recess or lunch or specials. So we try to target the schedule pretty carefully because I know those are really important that they don't miss those.
Thank you. And I this isn't a question, but I don't know if it'd be helpful to any of the other parents, but we just recently started our son on medication because I was one of those people for a long time that was like, oh, I don't want to do medication, and I'm not saying medication's for everybody because I'm sure it's not, but I kind of wish that we had started a little bit sooner because, for one of the reasons why we decided to try it is because we realized, like, what's the worst that could happen? We don't like the results, or we don't see results, whatever, and we stop it. You know what I mean? It doesn't have any long-term effects. And so, anyway, it was just, I was wishing that maybe we had started a tiny bit sooner because our son was having a hard time regulating his impulses, and he was just getting in trouble a lot. And so there was just a lot of negative interactions. And it was sad to realize that, there were so many things that he really couldn't help. He didn't have the skills and the tools to do it. And with the medication we started with, he's been able to control his impulses so much better. And we have this happier relationship with him. And it's sad to say that because we didn't have to have negative, interactions with him, but he was just always getting in trouble and stuff. So I just wanted to say that in case there are other parents who are thinking, oh, I don't want to do medication. You could try it and it might make your home life a little bit better. If you can try it and you can stop at any time, so I guess I just put a word out for maybe giving it a chance and not being afraid to try it, because it could have a positive impact in your home and your relationship with your child if they were anywhere similar to what our child was experiencing.
Thank you so much. I love that sharing. It is a tough decision, and we've been there as parents as well. We had to really look at our son and really decide. And what kind of was the tipping point for us is he was burning bridges with friends. He was burning through friends pretty quickly. He was a little too intense energetically for them and a little too demanding and in their space. And we started seeing it really affect him socially. And that kind of broke my heart. And same thing, he was getting a lot of negative feedback. And for us, it was the same experience where medication has been a game changer. It's been phenomenal for our kid. That is not the same, I know, for everyone, and it's not for every kid. But I do like that about the stimulants is you can always just try them and then you can always pull them off. It's not a huge commitment because it's not something that they have to be on or build up and take every day and stay on, wean off. The non-stimulant medications are different than that, where you do have to follow a daily building up and then pulling them off because they affect blood pressure. But the stimulants are nice that way. You can just try them, which is kind of nice.
All right, I have one. Oh, go ahead. Sorry, it's hard to tell whose turn it is. I just have another comment. With those resources that you have, those like charts where the kids keep track, because I feel like I'm this nagging mother who's constantly telling my kid, like even my daughter just showering, it takes her like an hour unless I'm like every 5 minutes knocking on the door. And